So I decided to be a nurse as soon as I got out of school. I've been with the Team Care Coordination program for well over 14 years. Certainly enjoyed every moment of it. We sometimes get calls from people who are overwhelmed about the health system or how to access services. And people like to be independent and make their own choices, but they often need support just to get a bit of navigation on how to get those services at home. So having somebody to help them coordinate that and work out who's who in the health system does help people. Then they can move on with some decision making and make sure that they're getting the right service for them. So we like to pride ourselves on getting things done. We work alongside other organisations. We do a lot of phone calls in the background, research, and help people get those services. Or if they're not available, we need to look at something else and perhaps think of other options. Our team's very respectful for each other and for our colleagues, and we talk to each other and we work well as a team.
I love working as an occupational therapist, looking at the big picture and not just the small injury or event that might be impacting someone, but looking at the home, the person and what they're wanting to achieve. I see clients who have had falls at home or in the community, and this is serious because it can lead to premature death or early entry into care. And these clients who have had a fall are then at risk of further falls. So I often do a lot of telehealth with our clients. So our clinical nurse will be there with the client at their house and they will call me on Teams and we'll have a little bit of a chat and have a look at the home environment, have a look and see if there's any trip hazards, look at how the person moves and functions within their home to see if there's any pieces of equipment, maybe a mobility aid, make sure there's adequate lighting so people can see where they're going, and really sit with the client and understand how they're interacting in their home. The Team Care team is a really fun, dynamic team to work with. Everyone genuinely cares about each other and our clients that we see, and we all just want to make a difference and keep people safe and well at home.
I love my job because I love helping people. I like to support people to be able to help themselves. I want to help people to stay at home and continue to living their best life. Most of the areas that I've worked in have always been around heart, whether it's heart surgery, patients having heart attacks, it's all to do with heart health. I like to help people if they're very seriously ill and it's coming towards the end of life, that they're prepared and that the family are prepared, and try and give them the tools to have as happy and as peaceful a death as possible. And so often I'll bring the topic up as part of the assessment and as part of that holistic care was saying it's about seeing you as a whole person. If we can help you to make the most of what's available in the community, to live as long as you possibly can, and preferably at home, so that your time in hospital is only when you need to be. I've been doing this job, say, for 6 years now, and we have a really good team. We work well together, we can bounce ideas off each other. We've all come from different backgrounds. It's about bringing that all together, and we can use each other to give the best to our clients.
I enjoy working as a nurse because it gives me the opportunity to meet lots of different people from various different backgrounds. You have to be compassionate, you have to be non-judgmental, and just willing to sit and listen to somebody really that can make, let's say, the biggest difference. Often we see people in the community who have asthma and diabetes, which are some very common chronic diseases. So some people may have problems with breathlessness, just even getting dressed or having a shower. And when you chatted to them, you've realised that they've not been using their inhalers correctly, and just sitting and talking with them and re-educating them how to use the device can make a huge difference. People with diabetes may not know how to manage their blood glucose level very well, so we can educate them on how to use their monitors, what the numbers mean, and how they can respond to those numbers. So we give people time at the assessment, and then we follow up by phone call as often as needed. I would say that our team is very well blended. We have various different skills, but we all have one core value, and that is in ensuring that we do the best for our clients.
I love being a nurse. I love chatting to people all day, learning their stories, listening to them. Social isolation is a big problem for people. It has a really negative impact on people's health. It's shown to contribute to poorer health outcomes for people. If they don't have something to look forward to, people often struggle with their day-to-day. Often they tell you, I just don't get out that much. I like being at home. A lot of your friends, unfortunately, through age or health, they start passing away, and so they have that less of that friend support. Team care can really help by helping them connect with services, so directing them to available resources that we know that are in the community. So trying to find ways to help them either get out to the shops. There's also social groups and social clubs that we can help you connect with. I think a lot of the bus trips, I think the girls really like, because it's getting out to do different things. I think they go to the seaside, out to Redcliffe, or they go to the theatre. Our secret ingredient is that we're all very welcoming. We're warm, encouraging, a lovely team that you feel comfortable opening up to. It's a lovely place to work. The whole team, the whole PHN.
I've been a nurse for 20 years, probably more if I'm being honest. I enjoy meeting different people, seeing where they've come from, hearing their stories and seeing how I can help. One health condition that's really close to my heart is memory loss and dementia. I've had a close family member be diagnosed with dementia. It puts immense pressure not just on the person with the diagnosis, but their loved ones. You worry that you're losing them earlier than you should, because each day there can be some very small, subtle changes to their personality or the way that they're able to live their independent lives. Team care coordination can visit the client in their own home. We can find out exactly what is being an issue, and using our team of really dedicated chronic disease nurses, we can look to support you all in the situation of your own home. Team care coordination are a small team, but each of us brings something different and something special, but all of us have a love of dealing and helping and support people with chronic health conditions. And that for us is what makes it a really good team to work in.